Well, welcome everyone. My name is Ali Shivji, and I am one of the principals and the Chief Quality of Life Officer at Optima Living. And today we are so incredibly blessed to have Dr. Adrian Wagg with us, who is renowned in multiple areas. But I guess the easiest way to talk about Adrian is being kind of the AHS Chair of Healthy Aging. He is a senior leader in the Department of Geriatrics at the University of Alberta, and just an amazing kind of resource when it comes to knowledge about aging, healthy aging, aging fearlessly, and specifically when we've been thinking through this idea of COVID, and really what does it mean for populations and for overall how we live a quality of life worth living. It's been an appropriate topic for us to start to get into with Adrian and Dr. Wagg. And so I want to just come back for a second to the topic that we're going to be talking about today, which is the idea of aging fearlessly in the era of COVID-19. And it's important to set some context as to why we decided to do a webinar on this topic and why we decided to pick this specific area of it. And it kind of starts off because at Optima Living, we have found that throughout our 9 kind of residents and communities across BC and Alberta, we thankfully have had no cases of COVID, and our teams have been very vigilant about trying to educate our residents, their families, and everyone on what are the things that you need to do from a precautionary perspective to make sure that you're proactive and you're taking care of things. But our conversations have now really shifted a lot to the next part of it, which is around, well, what do we do to lead an incredible quality of life? And how does our philosophy, which is let us welcome you home, let us create your best quality life, how do we make sure that no matter where we are, no matter what era we're in, no matter what situation we're in, people are still able to live their best quality of life? And from that perspective, Dr. Wagg, we wanted to engage you today around this whole conversation about what people are asking, effectively saying, how do I age fearlessly? How do I continue to live that best quality of life that I can live in a time where people around me, there's a lot of news that's scary. There's a lot of inaccurate information. There's a lot of fear mongering. There's a lot of other things that, there's a lot of guiltifying of others. And what we have found is people continue to come to us as Optima to be a trusted knowledge source, a trusted knowledge partner that they can engage with, that they can trust the knowledge, and that ultimately we'll be here to help people make decisions because we'll give them the right knowledge. We'll be here in the context of looking at the best quality of life for every person that we can. And in part of that, our contribution to the community is being able to create opportunities like this, which is to bring people together and to talk about meaningful topics that are really relevant to them. So today I wanted to be able to take that attitude of like positive and collaborative thinking, take that attitude of families and residents and communities that have so much worry or so much anxiety right now as they're thinking through all the different things that they're trying to think about. And also we're trying to demystify some of these things and actually get to a point where we can have a proper conversation about what life should look like and how we think about the next steps. So with that, Adrian, I thought we would, you're okay if I call you Adrian, I hope. Let's jump right into a couple of questions that I think will be helpful for us to start and give some context. And the first is, we think a little bit about this whole COVID-19. How long is it going to last? And I know there's probably a couple of nuances to that question, but let me just start there. How long is this all going to last?
I think you're right. There are immediately a couple of different things there. How long is coronavirus going to last? I suspect that it will become what we call an endemic virus, just like flu, and to which we've all become used every winter. This novel coronavirus hasn't been around long enough yet to really get an idea about its pattern of disease, because we are all mostly non-immune to it. We are to varying degrees susceptible, and it will be in the community. It will become a permanent fixture of everyday lives and risk until we have an effective vaccine. And as you've heard from the news, there are probably 58 different companies around the world working on a vaccine for the virus, and there are trials ongoing. That said, it will still be probably the middle of next year before we have meaningful developments. And of course, then getting that to the many millions of people who will require vaccination is an incredible logistic challenge. So that's the
Yeah.
one thing. Eventually, it'll be in the community, it'll be there, and it'll be a risk for which we are vaccinated if we're sensible, like we are to influenza. How long the vaccine will last, we don't know. What kind of vaccine, we don't know. How good will it be, we don't know. There is some interesting evidence starting to emerge around resistance to the infection and vitamin D deficiency. So certainly, for two reasons, we should be using extra vitamin D. A, we're not getting out as much, and B, there may be something about resistance to infection and vitamin D supplementation. The next thing is that in the days of TB vaccinations, to which many nations had automatic national vaccination, there may be something there about resistance to infection. So there's been some, again, call to suggest that in the meantime, should we reinvigorate BCG vaccinations where they're no longer done. The next thing, of course, is how you deal with it and the current, what's been termed lockdown to various degrees. And clearly there are intended consequences, and the intended consequence was not to have a huge exponential growth in infected people requiring acute and emergency health services and intensive care units. And that in Alberta appears to have largely been effective so far. I'm not aware to what extent there's been much difference in British Columbia. I know Optima, obviously, are cross-provincial. We, I think, have been successful limiting congregations of people to 15 or fewer with physical distancing, but the effects on the economy and the consequences of people's mental health and well-being are clearly huge. Rightly, the most vulnerable at-risk people are those in our nursing homes and long-term care institutions. We've seen, particularly around Calgary, the toll of coronavirus, and again in the UK, when nursing homes particularly have been exposed and unable because of the nature of the residents to contain that effectively and to control that. So I think we're now getting towards the tipping point. We know that in Alberta, mid-May may be the peak. Interestingly, there's been some suggestion that regardless of what you do, there's a 10-week cycle of virus exposure, infection, and then a wearing off of effect. There's an Israeli professor who's put this forwards, and we will only know when we look back how effective measures were. We know that, for example, Sweden is adopting a very different policy in terms of physical distancing. It still has schools open, it still has bars and restaurants open, but physical distancing rules are in place. We know that the United Kingdom has been perhaps a little later, but now quite strict in its social isolation and physical distancing rules, and Alberta and British Columbia are operating a halfway house. I think here in Canada we are protected partially by our population density. We are, where there are fewer people per square kilometre, even in urban environments, and they say than central London. So I think we're coming to the time when governments and administrations are starting to think about how to relax the physical distancing, allow how we can increase activities and get back to a semblance of normal. We do know, however, that older people are more at risk, and those with other chronic diseases are more at risk. So are those things going to be any different? We certainly know that for those people with people living with dementia, for instance, are at very high risk, wherever they may be living, either in the community with family care partners or in residential and long-term care with care providers who are paid, how very differently and how carefully those people have to be dealt with, particularly as coronavirus symptoms are very different in older people, and older people, as we recognize, may present what we call atypically, where they might necessarily not have fever, cough, but may have muscle aches, joint aches, may present with worsening confusion. So we know some things, we have some plans, but the thing simply hasn't been around long enough for us to be really certain, and there's a lot of speculation.
So, and I think it's you've had some interesting points here, right? So I think when we talk about how long COVID will last, I think there has been in the community that it's going to be there'll be a world post-COVID. And I think there's world pre-COVID and with COVID. There isn't going to be about how.
And the sound is going badly.
Okay, can you hear me now?
I can now.
It's better. Oh, perfect. I was going to say that pre-COVID and like COVID, be very clear about that. They'll have a world where it won't happen. That's not going to work. When we think a little bit then about how do we live with a life in COVID, how would you how would you start to kind of help us think a little bit about if COVID's going to be part of our lives for the foreseeable future? What are some sorts of things that we need to start thinking about so that we can start to reemerge in our lives, but we can do it in the most thoughtful and yet pragmatic way? Because I think sometimes there may be things that are just overly unpragmatic about it, but how would we think about that if you'd think about it from that perspective?
Again, a lot of speculation. Whilst there is no vaccine, it is likely that physical distancing will still be encouraged, that 2 meter distance thing. So shaking hands and hugging maybe out of the window for a while. There's recently something I saw, a Swiss professor who's suggesting that grandchildren can hug a grandparent. There's little evidence, if any, that transmission appears to be from children to adults, but much more from adults to adult. There's the whole should we wear masks in public thing, where recommendations are that it's probably a very little evidence, expecting very particular circumstances, and it's very difficult to use evidence from countries who are more culturally more distant and often do wear masks to Western populations. We've seen people outside wearing masks, and again, if you are practicing physical distancing and are outside, there is absolutely no risk of transmission. So where you can't practice physical distancing, there may be some evidence that in certain circumstances, wearing a face covering may protect others from you. And that's all because there are people in the community who shed virus who are asymptomatic. So there's a lot of we don't knows. You will have seen in the press, how do we get public transport back on with physical distancing? How do we get airlines and tourism back going with the needs to physical distance? And what precautions are we going to have to take? And again, most of that's speculative.
Yeah. So a couple, maybe a technical question to start on this one is, is the only way that someone could, let's say for instance, I had COVID today. Do we know yet if the only way that I can transfer COVID is through coughing, sneezing, and that if I had a mask, I would effectively protecting everybody else from that? Or are there other potential ways that I could give people COVID even if I had a mask on, if I had it?
It doesn't seem to be the case. The evidence is that it's not aerosol spread. Okay. So small virus particles hanging in the air for a much longer period of time, unless you're in very small environments with no ventilation. And then we don't know whether the amount of virus is enough to infect anybody. Okay. We do, intriguingly have some evidence where asymptomatic populations, I think there was a prison in the United States, were tested, and half of them proved to be COVID positive without any symptoms. And so somehow had been exposed, but we don't know when, why, or how. So
Interesting.
whether there's a big problem with the test, and certainly the timing of the test and the type of test you have makes a difference. And they're saying that the test picks up about 80%, and you might get up to a 20% false negative test, depending on the timing. So the test
Yeah.
isn't perfect, but getting better. And the nasopharyngeal swab that people should ideally have, it is uncomfortable and needs to be done properly.
Yeah. There have been some questions, and I'm just going to pause here for a second. Thank you to everyone who submitted questions ahead of time. We're going to try to go through these questions as Dr. Wagg and I kind of go through this dialogue. To the extent that anyone has questions they'd like to ask on the webinar itself, there is a little question and answer tab on the bottom of the screen. So feel free to just type in any questions you have there, and I'll be monitoring them here and try to engage them as much as I can throughout the conversation. So, Adrian, there's a couple of questions here around this idea of, wearing masks. And so, one, if I'm going out in public right now, I don't think I have COVID, but I guess I don't know because I haven't been tested. Should I always be wearing a mask?
As I say, there is very limited evidence of having any protective effect for asymptomatic individuals. There is some evidence that if you have symptoms, and we know because the symptoms are so very general, a cold or flu or other viral illness may give you symptoms, then you go and get tested. You should probably wear a mask to protect other people if you're in close confines while you are symptomatic. If you are asymptomatic and practice physical distancing, wash your hands, don't touch your face, then the evidence doesn't support the use of masks. The problem is that we have a political, emotional response, and the evidence, the science is not very good. The evidence isn't clear. The evidence hasn't changed, and yet we see very different recommendations for mask wearing. Alberta Health Services now in the hospitals as healthcare workers have been advised to use masks when we're in clinical contact to protect everybody, but that's a close physical contact thing. So if you're out and about doing stuff and are 2 meters away from everyone, there's absolutely no reason if you don't have symptoms to wear a mask.
And it sounds like there's a common sense principle here as you're speaking, right? Which is around, there is physical distancing is a principle that I think we have to keep in mind. And there's that 2 meter kind of guidance around it. And then after that, I think things like the mask or otherwise are what you should be using to protect yourself and or others that are around you. But again, there is a common sense element that people should be using as we're thinking through this stuff.
Yes, and there's an old saying, isn't there, that common sense isn't as common as you think.
I think that's
maintain physical distance. No need to wear a mask unless you're in close proximity and you're symptomatic. The problem is that people are scared, and I have in our medical practice, outpatients has been stopped all but for what's called urgent cases, those people who might otherwise become unstable. I've had people that won't come to clinic because they are scared, and we have a huge emotional response to risk, and we're very bad at judging risk.
Yeah. And I think, and I guess and I can understand that because the whole risk aspect is one thing for us individually, but when we're taking on risks that we feel may impact others, there's that added worry that, okay, will my actions have a negative effect, or will it present a more of a risk for someone else? And that might be where people have a lot harder time kind of trying to
yes, and you need
to navigate.
You need to be judged by symptoms, I think. If you have symptoms and you go and get tested, you wear a mask. If you're out and about doing something, you don't have symptoms, you don't need to wear a mask if you practice common sense. Physical distancing, wash your hands, don't touch your face. The thing about wearing a mask is it may give you more confidence, you may get closer to folks, you may touch your face more. The masks don't last very long, they get soggy, and then they're no longer protective. So
let's just on that, just so that we clear the ice on this one a little bit. this idea of those symptoms that people should just watch for. So they're not risking about them. They watch for them, and then they're comfortable. What would you say are kind of those key symptoms that they should watch for?
Sorry, I missed that. How do you mean in terms of
I was going to
illness?
say, like, yeah, like in terms of illness, like just in terms of like if we're thinking of the average kind of, in this case, a lot of our population, and on this call are probably kind of like seniors, particularly in in Alberta and BC. And so if we're looking at those types of that segment of the population, what types of symptoms should they be watching out for themselves?
Well, again, it's typically cough, fever, shortness of breath, difficulty breathing, not necessarily runny nose, not necessarily sore throat, but in older people, loss of sense of smell, loss of sense of taste, joint aches, muscle aches, and chest pain have come up. And the more this we find out, the more it goes on, the more we know that sometimes those cardinal respiratory tract symptoms may or may not be present in older people. And the fever may, of course, be very mild or sometimes absent. Older people don't mount as much of a fever.
Okay, fair. So that's helpful. And then if we then say, okay, so if we're going to watch out for those symptoms, and if we summarize that part of saying, look, watch out for the symptoms, use common sense, and make sure that ultimately, once you're conscious of those symptoms, if you're asymptomatic or not, you wear a mask, you wash your hands regularly, you are using kind of good steps of physical distancing. That gets us past the basic hurdle of the fact that we're gonna live in a world where COVID-19 exists. So I guess the question now becomes, if we shift to where we wanted to take this webinar today, which is around, now, how do we age fearlessly? How do we make sure that we can now be proactive and we can be positive about how to both counter the fear that may be out there from the societal things around us, and we start to embrace a more kind of hopeful, living, engaging time in our lives? How do you, maybe let's start off with what are there certain mindsets that you think people should start to adopt or keep in their mind? And then maybe let's go into that thread a little bit about how do we encourage people to still live an incredible life and not let this stop them from doing so?
It's possibly about well, the first thing you might do is not read the news. I think there is so much on the news that actually adds to worry and concern and fear. Obviously, you can't do that, but you need to moderate that in your own mind and be critical. We've seen multiple sources of misinformation around conspiracy theory, around 5G networks, all sorts of things about manufactured which we just need to throw away as guff. And people say, oh, there is misleading information. Nobody says that it's downright rubbish and should be treated as rubbish. And we should maybe do that. We need to do the best we can to maintain a positive attitude, and that needs for us to remain socially connected. Many facilities, older people in facility living are essentially in now cloistered communities, but they can still be communities. And there is huge opportunity there for social connectedness. There's remaining socially connected with one's family and friends, even though there may be that barrier now. And that won't always be there, clearly. Regardless, the community prevalence of coronavirus is low, still low. The chance of going out and getting this, if you practice the usual things, is incredibly low. Yet we've seen people going out for walks be told that they can't go out for walks, even though they're hundreds of meters from anyone else, or can't go and sunbathe and actually get up their vitamin D, and be told to move on because of the requirement to what's been called socially distanced, but is actually physically distanced. So those things, in my mind, wholly unjustifiable.
Yeah.
We all need something to look forward to, and what we've had now over the last 6 to 8 weeks is things being slowly and continually removed from us as travel has shut down, as as commercial activity has shut down, as the ability to socially connect has shut down. So replacing that social connectedness with alternatives would be the obvious first thing to do by whatever means possible.
So there's, I know there's a lot of grandparents on the webinar today, and we'll be watching this afterwards. And there's this conversation about how do we, ultimately handle this idea of like children and seniors. And I think one of the questions that's come up here is like we said that kind of children don't kind of give grandparents COVID-19. Can grandparents give COVID-19 to their grandchildren? Like, is there a flip there too, or how would you recommend that grandchildren and grandparents are able to interact during a time like this in a safe way for both? Because I know that even in our household, we've been very worried about our children may or may not pass it, but let's say for instance they had symptoms and they gave it to to their grandparents. Their grandparents have a much higher kind of a risk rate. And so how, are there parameters that you would recommend, particularly around the interactions of grandchildren and grandparents?
Again, I only have seen what was in the press as much as I haven't seen the original science, but again, maybe somewhat speculative. There is an absence of evidence as much as evidence of absence of transmission. I think the questioner mentioned, if their mum was symptomatic, can the child carry the virus? There must be a potential. I don't know the level of the risk. If the child was obviously hands washed, usual things. I simply don't know.
Yeah.
I think if everyone is asymptomatic, then that was what the evidence was based upon. I think the games change if someone in the household is symptomatic. I have a colleague who's a bit younger than me in the UK who's a doctor who got coronavirus and passed it to all of her family within a day or so. And then, as I say, the game changes. That's a self-isolation. That's a quarantine situation, until everybody recovers.
Yeah, and I think that's maybe a good kind of underlying factor is that there's not one clear answer here, but I think there are parameters that one has to kind of abide by. And if I heard you correctly, it's around go back to the common sense, right? Which is, what are the symptoms? And if anyone has symptoms, then the games change, and you have to be really careful about that. Yes. If you're aware of the symptoms and you don't have any of them, then take into account some of the precautionary things that we talk about, including perhaps wearing a mask or other things. If you need within social, keep the physical distancing, but don't stop your interactions. And if it's even with grandparents and grandchildren, I think maybe that's the way to look at it, is symptomatic versus not, and how to think about that interaction.
Yes, I think again your question mentioned, can grandparents pass this on to grandchildren who can act as vectors?
Yeah.
The likelihood again, but as you said, I think the thing is, there is a symptomatic individual in the equation.
Yes.
If you're asymptomatic and asymptomatic for 2 weeks, then it's very unlikely that there's something lurking.
Yeah, no, I think that's an important thing, is that if there's a symptomatic individual, then we have to keep that. We have to then use the thought process of what is common sense around that sort of area. And as soon as you've got symptomatic situations, then you have to deal with it in that way.
Yes, just out of interest, I heard a chap phone on CBC last week who was astounded that he saw somebody blowing his nose in Walmart and took a photo of this guy and reported it to management. And when you get that kind of behavior, it needs a proper open discussion about how ridiculous that kind of thing might be. The guy might have had seasonal rhinitis.
Yeah.
Common.
Yeah, I mean, I know I carry hanky with me all the time because and it's just,
don't go to Walmart.
Yeah, exactly. Apparently I should not go to Walmart. There was a question around here around kind of, how about moms with very young children if a mom is symptomatic? How does physical distancing work?
Again, I think in China they started to put people who were symptomatic in isolation from their families. The risk of transmission within families in close confinement in the same house is high. again, the game has changed because there's a symptomatic individual in the equation. So if the mum was symptomatic, isolated from the children, and the children were well for 2 weeks, then you're okay. But the symptomatic individual in the mix has changed things.
Yeah, and I think like one of the ways that we've dealt with this kind of from our family perspective is we actually sat down and said, okay, let's think about every member of our family, my parents, my children, myself, my wife. Let's actually just put together, like, in the worst case scenario, if any one of us got COVID, how would we handle the following things, right? How would we handle our interactions with each other? How would we handle how they would get food, isolation, healthcare, when should be hospitalized, and by kind of actually demystifying that and what that worst case scenario was, we just had a plan in place. And we decided as a family, we've decided that, if one of us gets sick, just the four of us are going to hunker down and we're all going to get sick together, but we're going to be together. And I think to the extent that people can just have those conversations and be able to discuss them, then they've planned for the worst, and that they're not sitting down afterwards panicking if something does happen, but instead they've kind of made the precautionary things that are helpful, and that's just been very helpful for us.
Yes, I mean, it's interesting around vulnerability. There's some increasing evidence that, of course, men are more susceptible than women for a bad health outcome, and that may be around health behaviors, coexistent diseases, smoking, alcohol, as much as a true sex-related phenomenon. But we only have one X chromosome, where women have two, and they are maybe most of the resistance genes, if you like, for ease of expression, are on the X chromosome. There seems to be something about Black and ethnic minority individuals who may be more susceptible. Certainly there's been an excess of deaths both in the United States and in the United Kingdom, particularly amongst healthcare workers. And there may be something about the way the virus gains entry into cells, where that little receptor is differently expressed in non-white individuals. And the other thing about the children, again, is they often don't have the receptor per se. So we're starting to learn something about susceptibility.
Yeah, interesting. So would you say then, well, actually, one of the questions that came up is like, okay, if we go into, well, actually, before I get there, let's talk a little bit more about their susceptibility, because there was a couple of questions, and one was around, are handmade non-medical masks effective, in the same kind of purposes that others would be?
Not as effective. They're, if required, better than nothing. And you've seen, again, on the media and various places, that medical masks are really good for healthcare environments and are used appropriately. If there's nothing else, a cotton cloth self-sewn mask may offer some protection, as much as it will from coughs and colds.
On the topic of the common sense while living with COVID, I mean, if we're going to the grocery store, there's a couple of questions that have come up on, should I wear gloves? Should I wear a mask? What should I do if I have to go into an environment like Walmart or a coffee store, like a grocery store, where I do have to interact, I do have to pick up stuff. Like, what would you say are some best practices in that regard?
Before you go in, clean your hands when you come out and get home.
Okay.
Don't touch your face. Don't hug people that you don't know.
But not necessarily worry about wearing gloves and other stuff.
Wearing gloves, and I don't know what they think they're doing. Yes, they don't get stuff on their hands, but they don't take their gloves off properly, and we have waste gloves knocking around all over the place. There are some bizarre healthcare beliefs. I've seen people in full gas masks and coveralls out and about, and they look ridiculous, and are being ridiculous. And we shouldn't be shamed into doing stupid things.
Yeah, common sense isn't always so common, is it?
Exactly.
Should I cancel my medical appointments until things are back to normal?
So, no, absolutely not. If you're being seen for a chronic disease and have an appointment, you don't have symptoms that might be related to coronavirus, you may be asked to wear a mask in the healthcare environment, but you should go and see your doctor. We've seen a huge decrease in clinical activity in primary care, in GP land, and we're stacking up disasters for later on. Obviously, if you're acutely unwell, you should go to the hospital if there is an emergency.
Yes, no, absolutely.
I think there's a big public health message across the country in, healthcare still is still there for you. You don't stay away if you need help.
Yeah, no, absolutely. I think that makes a lot of sense. How would you like, there was a question here on can seniors engage and be able to meet person to person, in person? And I think we've covered a little bit of that in terms of, you know, uh, you shouldn't stop living your life, but do it in a safe way. If people are symptomatic, all cards change. I think that's when people have to first and foremost kind of separate out, you know, that. But once you've done that, then being able to interact with people within the right kind of precautionary environments are probably something that people should still do.
Yes, yes, and we've seen people in the community still having collecting around a fire pit, but they're 2 meters apart. People doing as much as they can usual things, and that should be encouraged.
Yeah.
Taking the usual precautions.
So, Bob on the webinar just asked a question, which I think is actually a very relevant one, around saying it looks like there are many levels of being sick, right, from the disease itself or from the virus itself. It could be, and is there an explanation as to why some people get flu symptoms, some people die, and is there a way to prepare for being better immune to COVID? Is it, be it the food, be it the vitamins, be it other, and I think that that second part may have multiple aspects to it, but maybe we start off with like just these like why do different people have different symptoms for this?
So we know that being elderly, having other things wrong with you, being obese, having chronic respiratory or heart disease, all of those things are associated with poorer outcomes and more likely to get more severe disease. However, for 85% of the population will get very mild, a cold-like illness which will go away. 15% may require hospital at some point. So we're starting to learn what the risk factors are for a poorer outcome and who might get hospitalized. But of course, they're not permanent, they're not absolute. And we've seen in the press, younger people who are seemingly completely well also do poorly. As to the second part, is there a way to prepare to being better? Keep fit. There are no foods that we've seen adverts about how to boost your immune system from food and vitamin. It's absolute rubbish. We've also seen an advert from chiropractors slammed for suggesting that chiropractic can improve immune system. Complete rubbish. You might as well shove a carrot up your nose, quite frankly. And again, it's classified in the press as being misleading. No, it's not misleading. It's drivel, and we should see it for the drivel that it is.
One of the things that I think is important to make a distinction there, because I think you're right. I don't think that there are, from what I've seen at least, and I'm not clinical, so by all means, you probably have a much better take on this, but that it's not that there are specific things that will help protect you against coronavirus. That there's a silver bullet. You go drink a tonic and you're fine. However, I think there's something to be said about leading a proper kind of having a proper balanced diet, doing all of the things that you should be doing as in a regular life to have a good quality of life, be it the food you eat, be the exercise you do, be it the smoking you do not do, or the drinking that you limit, or that, all those different things that ultimately put your body in a place that it is at its best and like immune situation that probably will help you in general.
Those healthy aging behaviors are good per se, or are least harmful. But I don't think there's any particular specific evidence that those would improve your defenses against coronavirus. We simply don't have innate immunity.
Yeah, no, and would it be against getting the coronavirus versus its effects on you? I guess is a question that will be out to see what happens in terms of that.
If you're fit, robust, and healthy, then you you improve your likelihood of a good outcome. That's the key.
I think that is a really important point, and you're right. You can't change your ability to get, or you cannot reduce your ability to get or not get the virus based on what happens out there. But your body's response to that virus can probably have a direct correlation to how healthy you are, and how much you've taken time to actually take care of yourself and do all the things you need to do.
Yes.
Okay, interesting. That's a really interesting point, because one of the things that we particularly the Optima, we've written a blog on this, and even on the Astor Gardens website and the Optima website, we've put it up, which was, people have been asking us the question about, how do you think about this and how do you live a good quality of life? But more particularly, should they take their loved ones out of facilities? Should they not have them live in residential communities? Should they not have them in independent living communities or other places? And we've taken the approach to say, look, one, we're not going to tell anyone what to do. We're going to be we're going to be a knowledge provider. We're going to provide you with the right information to make your decisions. And we've kind of said, look, when we think about the aspect of living within an environment where you have, independent living, seniors living, seniors care, they all have different nuances to them. But ultimately, and all birds are not equal, or all, whatever you want to say, they're not all equal. But what we've said, at least at Optima, is to say, look, first of all, we'd like you as families to think about a couple of things. One, we want you to make sure that you've thought about how are you limiting the risk of exposure of the disease to your loved ones? If you're bringing them home versus not, how much are you controlling it versus what we as an organization are very actively controlling? Two, are you making sure that you are thinking about all of the quality of life metrics that are really important to someone's overall quality of life, their nourishment, their engagement, the ability to monitor their behaviors or something is wrong, what they're eating, their activities, the people they interact with? Are you able to make sure that people have a good quality of life, as opposed to bringing them home, keeping them in a room, having a bunch of falls risks around you because we have it, your house is a split level and has a lot of stairs, or you have, you're already working, so you don't have time to engage with them. So how do you think about the quality of life? And then the third thing is, do you have a plan if your loved one or someone in your house gets the disease or gets the virus? Because again, as we think about, independent living, we think about care facilities or our communities, we think about those three steps very, very seriously, so that every single one of those things we take care of on a regular basis and make sure that that we have plans for all of those areas. And the last thing we tell people is, if you've got answers to all those questions and you feel confident, great. Can you sustain it for 6 months or longer? Because the last thing you want is to come home and within a week or two say, I can't stand this. I don't have what mom needs. And now you want to take them back to the community. But now you've actually introduced a risk, because we don't know where, the symptoms they may have come in contact with, who they're with. And so then we have to, then you have to isolate, then you actually create and introduce a lot of risk into a community that's there. So I don't know if you would concur with that or not, but I think for us, we've been trying to help people understand that it's safe to live.
Clearly, families are concerned, particularly where they're in long-term care. And we saw that rather scaremongering article a couple of weeks ago in the Globe and Mail about take your elderly relative out of their nursing home. Completely ridiculous. And I think a lot of the professional societies have rightly slammed that article.
Yes.
People, particularly in nursing homes, are extremely frail, more often at the end of life. And naively, families believe they look after them. And as you rightly say, if then someone in that household becomes symptomatic, how does that individual cope? And
yes, no,
we're seeing from hospital, of course, facilities rightly are cloistered, and the individuals are going back and having to isolate for a couple of weeks before they're reintegrated. So huge amount of problems.
Yeah, no, I think, and we've definitely basically helped people say, like, let's separate out some of these characteristics, right? You've got long-term care facilities, and then you've got independent living facilities. They have different criteria. But then from that perspective, what we found is that not only is it safe to live in independent living, or even sometimes a long-term care facility, but it's actually one of the best things that you can do, because now you actually have people trained to make sure that they're watching. You have the right nourishment and all the things to sustain and enhance your quality of life, but your immune system and also your stimulation from the perspective of who you engage with, that really makes a huge difference.
And as you rightly say, families are potentially taking an older person out of their home with all of that readjustment and disruption to life and connections, and maybe cannot cater to a similar extent to that the older person can cater them for themselves in their own environment.
I have found that sometimes we, by caring as much as we do for our loved ones, sometimes end up making very selfish decisions because it's about us, not about them. And sometimes, particularly in our field of work, we have to remind people all the time that this is about your loved one, not about you. And you have to distinguish what are the decisions you're making and why they're making that.
Yes.
There's a couple of questions that have come up here. One, there's themes around this idea of kind of like mental health and stress. how what that effect is and what that link is to a lower immune system, and how do people kind of handle the mental aspects and the stress and the anxiety that's coming up around this disease, and what effect does it have on them if they don't?
Uh, Wish I could answer that, but yes, undoubtedly this has a mental toll on people, and there are lots of online resources that are available or could be provided, particularly in facilities around mental health, psychological support. I know certainly for those people for whom spiritual support is important, then many religious organizations are using similar online psychological support to help people. Maintaining a structure is clearly important, and a bit of self-discipline and making sure you've got things to do,
Yes.
all really important.
Tell me,
Meditation, mindfulness, you name it, all been advertised as being useful for older people as much as younger people.
it's a question here about kind of like, do you have any ideas for helping seniors calm their central nervous systems? Kind of like, get up each day, live a calm and positive place, and tools and techniques that you've seen around that sort of area of your overall kind of.
Again, sense of purpose, positive mental attitude, engaging in activities from which you derive pleasure. People have talked about developing, learning new activities, doing stuff you enjoy, but remaining with some sense of purpose and some structure is really important.
Yeah, no, I think that makes a lot of sense. And sometimes, what I found is that because right now as we're working, our lives are so structured, we actually have a good routine, but it's so interesting that people who are not leaving their houses, they're not doing other stuff, they're being scared, that they're getting rid of their routines, and yet physical activity, the right timings, eating regularly, doing all of these things, the routine is actually very, very important, and
Yes.
can be detrimental if the people don't have it.
Yeah. I see someone said about taking a 90-year-old out of her house. She's living alone. Is it safe for her visit her family?
Exactly.
Providing that everybody is asymptomatic. I mean, the guidelines suggest that thing is to be discouraged, but I would say, providing that everyone is asymptomatic, exactly the history, then potentially that would be possible because the risk is potentially extremely low.
Yes. No, I think that makes a lot of sense, and something that people have to keep in mind. Now, obviously, when symptoms happen, and I think that's the biggest thing, when symptoms happen, it's not then things go out the window. But other than that, I think it's it is safe to do these things, what I'm hearing you saying, but you have to take the right precautions. And if you do that, then quality of life is so incredibly important in all of this, and how we think about that is super important.
Usual things. Everybody washes their hands. They don't touch their nose, faces. They maintain reasonable physical distance. I think that's the important thing. But
Yeah.
certainly, there are some regimes which have been far more hard about lockdown than perhaps we have in Canada, and I suspect that even my views there would be slightly out of kilter with some people's beliefs, but I would say that the risk is extremely low, providing that you know the history and symptom history of the individuals involved. And it's entirely an individual view on perspective.
Yeah, and I think that is an important thing, for sure, that we don't want to lose, right? That common sense, super important. Don't don't avoid that part, but don't also be in a position where you're not actually going out and doing the things you need to do. Aging fearlessly, as I'm hearing you say, is around this aspect of do the things you need to do to keep your purpose, your engagement, your quality of life. Just do them safely. And if you can do them safely, you don't need to just sit in your house, but you need to be precautionary. And I think as much as you can, I think that's super, super helpful. And it will give people the benefits they need to have the quality of life that they need.
Yeah.
I wanted to, I want to take a couple minutes to summarize the points we've talked about today. And then I actually wanted to take a moment to show people a sneak peek of a video that the Strathcona County has just put together recently about embracing your inner cat. But it's about actually completely around this idea of COVID and how to think about it, but I think it's a super creative way that that the Strathcona County has done that, and I thought it'd be a great way to close off this webinar. So I'll get there in a second, but you know, a shout out, but also just really enjoy that part of it. So you know, Adrian and Dr. Wagg, thank you so much for your time so far. And so what have we talked about today? We've talked a little bit about this idea of how long will COVID last, and we've really said, look, COVID is probably going to be here for almost in some ways eternity, just like the flu will be. It's going to become a commonplace thing, like the flu was. And if you think about it, going back to 1918, when the flu and the large epidemic happened at that time, you know, people were probably thinking similarly about, oh my God, like, what are we going to do about this? And today the flu is an everyday part of our lives. It's part of our lives, which means you have to take account of it and you have to think about it. I think the second thing is around this idea of like, because it's going to be here forever, we have to start acting and being common sense about that. We have to make sure that we're always thinking between, you know, what is common sense? What are things that we have to do to watch for the symptoms? And as soon as we see any of the symptoms, be it cough, fever, shortness of breath, smell, a loss of taste, chest pains, joint pains. And frankly, I guess I'd almost want to say that if you notice anything that's out of the normal, take the time to call, because there are phone lines you can call to just ask these questions. And why not ask, but be proactive about that asking.
I
But
think
once
both
you've done, sorry, go
have
ahead.
good online assessments that perhaps families could make
Yes,
available.
that's right. And we will have that online assessment on our website as well, both Optima Living, Astor Gardens, and other places for people to look at. But you're right, there's some very simple online assessments that are there. You know, then we talked a little bit about this concept of to live a good life, to age fearlessly. Once we've thought about the symptoms, we put that aside. And then we've thought about the simple things that we should think about, be it physical distancing, be it regularly washing our hands, be it, you know, taking care of our immune systems. You know, the basic things that are good precautionary measures, covering, you know, and maybe having a mask when we are symptomatic, or, you know, just being precautionary about those things. Then we started to talk about, well, what does it mean to live a good life? And you know, there was a lot of questions around how do we interact with our grandchildren, how do we interact with the people that we love. And I think these parts are around, well, if you're safe, if you're thinking about this, well, there's very little evidence that, you know, diseases, that the virus transfers from children to grandparents. Let's take that into account. And we all live with a bit of risk, but it doesn't mean that we can't live in a way that allows us to have the best quality of life possible. And if we're going to live fearlessly, don't like stop watching the news. Or maybe I've seen someone say limit it to 5 minutes a day, you know, for COVID related stuff, and then spend the rest of the time learning, reading, you know, doing other things that are such beautiful and positive things that are out there. I think there's an aspect of kind of the positive attitude that people have, and the socially connectedness that people need to really engage with. And then I think there's this idea of like, because of the fact that ultimately there is so much connection in your own life about how you feel from how you live your life. Live your life in the best possible way. Find the purpose that you want, you know, making sure that healthy aging is important, making sure your mental state of mind is there, you know, keep through your sense of purpose and deriving pleasure. And as you can do that in the proper way, you are effectively starting to live your best life. You are effectively spending time aging fearlessly. And those things are going to help everyone, you know, no matter how we think about that. So with that, I want to focus on one thing. The team. We have a, oh, can you hear me properly here? Just want to confirm you can hear me. Yeah. The team has just confirmed for me that we do have we had a prize that was a door prize for people who registered. And I believe that Linda Cambitz is the winner of that door prize. So Linda, we will make sure that the team gets in touch with you afterwards to make sure you get that prize. And thanks very much for registering and for being here today. And with that, I'm going to, I want to, before I finally close with the video, I just wanted to say a couple things in regards to our Optima family. And I just want to say that one, you know, on behalf of the entire Optima family, we really want to take this time to just thank all of our care partners and all of our teams for like the incredibly important support that you are giving our cherished residents every single day. For a lot of our residents, you are closer than their family, or you care for them just as much as family. And we know that, and we just appreciate, you know, the timeless and the tireless working that you are doing to bring care, comfort, kindness, love, and compassion to our residents and to their home. And, you know, we just want to say thank you. I want to share that there was a story yesterday we did these Optima town halls with our staff, and there was a story that came out that just touched my heart. There was at least one staff member who hasn't seen her family in 6 weeks because she sent her kids and her parents to her sister's house so that she wouldn't have any chance of getting them sick, just so that she could care for our residents on a regular basis. And we are constantly amazed at Optima how much our teams care so much about the residents and what they do, and we just want to say thank you. And I know that in some parts of the world, at 7 p.m. every day, people get out and they bang on their pots, and we want to know that we're silently but very truly banging on our pots for all of our staff and what they do, because they are just so incredible, and we're blessed to have them. So with that, I'm going to try to see if I can show everyone this video as a way to close off, and just a really interesting shout out as a sneak peek to.
As you can see, cats have mastered the art of physical distancing. Dogs, not so much. During this time, we all need to keep our physical distance and follow the official health directives. Embrace your inner cat. Thanks for doing your part to stop the spread of COVID-19. We will get through this together. A message from Strathcona County.
So just a quick shout out to our partners and our friends at Strathcona County, but I just thought that was such a great video, and also just wanted to bring a smile back to our faces, because ultimately life is about living with a smile on your face and about engaging life to its fullest. And if you can truly age fearlessly, it means that you take on life and you tackle it in the best way you can. And so with that, Dr. Wagg, I want to thank you so much for your time and effort. We really value the partnership we have with the University of Alberta, and times and opportunities like this to educate people on, and separate the messaging from fear to knowledge and engagement, and hopefully fulfillment and active quality of life. So with that, thank you very much.
Thank you, everyone.
Thank everyone who joined us today. We will be making sure that this is available on our website post, and it has been live streamed as well. So anyone who joined us on the live stream, we thank you, and we hope you have a wonderful day.
Thank you. Bye-bye.